currently we're looking at outcomes at our center with a few different populations. We work closely with the breast center, and our Kathy Sanders, our stress management expert, basically does the Peg Huddleston, which is a guided imagery treatment to reduce perioperative anxiety in breast patients. So we're kind of monitoring qualitatively kind of what's going on with that program. And this is actually a program that is evidence-based and has a lot of evidence behind it. I think it's important to qualify that it's important to look at what our patient populations is doing in terms of outcome, but everything we use is evidence-based. And especially for headaches, for instance, there's acupuncture studies that, Cochrane database reviews that show that acupuncture can be just as effective, and if not more effective and safer, than the prophylactic medicines we use in migraine. So what I see is kind of our role is really bringing a lot of this evidence to the public. So it's always nice to go beyond what the evidence shows, but everything we're doing is evidence-based and scientifically informed, and safe, of course. We also get a lot of referrals for breast pain, and again, by using guided imagery, by using stress reduction kind of techniques and looking at myofascial pain and the wide distribution of symptoms and the treatments we use, we've had very good success with them. And we've so far looked at about 15 of them, and we're using the SF12, which is a shortened version of it. The SF36 took too long and people were leaving too many blanks, so we decided to use another standardized measure that's the SM12, which is shorter than that. We're also working with the sleep center, and we're getting referrals from them for insomnia. And as Mary mentioned, what we try to do is really, we don't try to market ourselves or be displayed as something outside of the hospital, but how do we fit into the hospital? How do we fit into every service, whether it be neurology for headaches, rheumatology for fibromyalgia. So our project with the sleep center is basically that the patient comes in and they rule out any kind of sleep apnea or any other kind of specific problems, and then they go through evidence-based treatments with them, like stimulus control, sleep restriction, things that are just well-founded, and then they send them to us for progressive relaxation and to continue those different, questioning on the evidence-based therapies that they start, because they don't want to see the patient every week. They want to, see the patient once, give them the instructions, and then do their sleep study. So we give them an opportunity to add value, to continue their evidence-based treatment, to work hand in hand with them, and to add value with the progressive relaxation, which actually doesn't have great evidence, but it just makes common sense that if you're relaxed, you'll fall asleep. So a lot of problem solving is kind of using common sense, putting scientific evidence together, putting mechanisms together, but looking at really each individual patient and customizing things in a way that's safe and makes sense for that person and solves their problem.